Consider this your punishment, Elliot sneered, flicking on the light switch. The bare bulb illuminated what could only generously be called an office, a converted maintenance closet with water-stained ceiling tiles and no windows. The metal desk had one wobbly leg stabilized by a folded piece of cardboard. A computer that belonged in a museum sat atop it, wheezing like an asthmatic smoker. Since you can't seem to be a team player, Leora, you can work down here until you learn your place. His manicured hand gestured dismissively at the space, while the small crowd behind him, my colleagues, the people I'd worked alongside for 6 years, snickered. Aiden's high-pitched laugh cut through the others. Maya covered her mouth but couldn't hide her smirk. There's no ventilation, I managed, trying to keep my voice steady. There's a fan. Elliot pointed to a dusty desk fan with bent blades. Consider yourself lucky we're not terminating you altogether. After that stunt you pulled in the meeting, questioning the entire design team's vision in front of everyone, this is mercy. Renata stepped forward from the group, her designer glasses catching the dim light. The aesthetic considerations of the Metaflow Pro are critical to our rebrand. Your concerns would have meant a complete overhaul of the shell casing. Do you know how much that would cost? More or less than a patient dying because they can't reach the emergency shutoff. The words escaped before I could stop them. Elliot's face hardened. And that's exactly why you're down here. Catastrophizing, exaggerating, being difficult. He turned to leave, the others following like a perfectly choreographed exodus. Your system access has been restricted to basic functions. Your clients have been redistributed. Answer the phone if it rings, which it won't. The heavy door slammed shut. I stood alone in the basement, the sound of their laughter fading as they ascended the stairs. My hands trembled as I lowered myself onto the creaking chair. For 6 years, I'd poured everything into this company. I'd helped design training modules, solved implementation issues that stumped engineers, flown across the country on red-eyes to calm nervous hospital administrators. I'd built relationships with patient advocacy groups that turned skeptics into our biggest champions. And now I sat in a basement because I dared suggest that moving an emergency button to an inaccessible location might be dangerous. The first week passed in excruciating silence. I answered 3 misdirected calls and organized the ancient filing cabinet out of sheer boredom. I watched the maintenance staff come and go, giving me pitying glances. The second week, I started bringing my personal laptop. If they weren't going to give me work, I'd use the time to maintain my connections. I couldn't access the company system properly, but I could still check my personal email, where many clients had reached out, confused about my sudden disappearance. On day 14, I was messaging with Zoe, a former patient who now ran the largest kidney disease support group in the Northeast. She'd gotten wind of the redesigned Metaflow Pro and was concerned. The prototype they showed us has the emergency shutoff moved to the back, she wrote. Half my members can't twist their bodies like that during dialysis. It's dangerous, Leora. I was typing a response when I sensed a presence. Looking up, I saw Darius Chen, the CEO, standing in my doorway. In 6 years, I'd spoken to him exactly twice. Behind him loomed Elliot, face pale. Darius stepped forward, his gaze fixed on my screen. He read my conversation with Zoe, then leaned down and whispered something to Elliot. The color drained further from my boss's face. My company phone, silent for 2 weeks, suddenly lit up, then again, and again. By the time Darius and Elliot left without a word to me, I had 42 unread messages. Within an hour, the number had more than tripled to 147. I know you're invested in finding out what happened next. I was shocked, too, when everything exploded that day. If you're enjoying this wild ride through corporate hell, hit that like button and subscribe. Trust me, what happened next changed everything. Not just for me, but for thousands of patients who depend on our machines. Drop a comment if you've ever been punished for being right. I read every single one. I'm Leora Abani, 34, and before I worked at one of the nation's leading medical equipment manufacturers, I was a dialysis patient myself. 3 years hooked to machines that kept me alive while lupus nephritis ravaged my kidneys. 3 years of arranging my entire existence around 4-hour sessions, 3 times a week, where my blood was filtered through tubes because my body couldn't do it anymore. I know exactly what it feels like when an alarm goes off during treatment. The panic, the racing heart, the desperate need to fix whatever's wrong because your literal lifeline is malfunctioning. I know the weakness that follows dialysis, how your body feels hollowed out, how simply reaching for a glass of water can feel like lifting concrete. When I finally got a kidney transplant and recovered enough to work, I knew exactly where I wanted to be, helping improve the machines that had kept me alive. Not as an engineer, math was never my strong suit, but as someone who could bridge the gap between the people who built the machines and the people whose lives depended on them. Customer success was the perfect fit. I understood both sides. When doctors complained about feature complexity, I translated their frustrations into actionable feedback. When patients reported discomfort with certain components, I knew it wasn't just whining, it was crucial information. For 6 years, this approach made me one of the most valuable team members. My client retention rate was unmatched. Hospitals specifically requested me for training and troubleshooting. I had a reputation for solving problems before they became crises. Then Elliot arrived. He came from a consumer electronics background with grand visions of revolutionizing medical equipment with sleeker designs and innovative user experiences. He didn't understand or care that medical devices weren't smartphones. Their primary purpose wasn't to look cool. It was to keep people alive. The redesign of our flagship portable dialysis system, the MetaFlow Pro, became his obsession. He hired Renata, a hotshot industrial designer who created beautiful mock-ups with curved edges and minimalist interfaces. The marketing team swooned. The sales team salivated over projected numbers, and I watched with growing alarm as function was sacrificed for form in every iteration. The climax came during the final design review before production. 50 people crowded the conference room. Engineers, marketing, sales, executives. The prototype gleamed under the lights as Renata and Elliot presented. "Notice the streamlined profile," Renata gestured. "We've reduced visible buttons by 60% for a cleaner aesthetic. The emergency shutoff has been relocated to the rear panel, which allows for this completely smooth front face." My hand shot up. Patients with limited mobility won't be able to reach a rear button during an emergency. Many dialysis patients have access issues in their arms where their fistulas are located. They often can't twist their bodies while connected to the machine. The room fell silent. Elliot's smile tightened. "Thank you for your concern, Leora. We've conducted extensive user testing." "With actual dialysis patients?" I interrupted. "People with mobility limitations? Elderly users? People like me, when I was sick?" "With representative user groups," he said dismissively. "The data supports this design." "Show me that data," I challenged, feeling 50 pairs of eyes on me. "Because I've worked with hundreds of patients who would tell you this could be dangerous." "This isn't the appropriate forum for this discussion," Elliot snapped. "The design decisions have been finalized. No, people could die if they can't reach that button during a critical failure." "That's enough," his voice echoed through the room. "You're catastrophizing again. This meeting is about presenting the design, not reopening settled matters." I looked around desperately. Is everyone really okay with pushing forward a design that prioritizes aesthetics over patient safety, over people's lives? No one met my eyes. Not the engineers who knew I was right. Not the project managers who'd seen my patient feedback reports. Not even Darius, who nodded along with Elliot's vision despite having built the company on the promise of patient-centered design. The next morning, I was escorted to the basement. For 2 weeks, I sat in exile, watching my career crumble, imagining the redesigned machines rolling out to hospitals nationwide. I pictured elderly patients struggling to reach the emergency shutoff during a crisis. I imagined the panic, the fear, the potential consequences. That's why I broke protocol and started reaching out to my contacts from my personal accounts. I didn't share confidential information, just asked questions about what they'd seen of the redesign, what concerns they might have. The response was immediate and alarming. Zoe's group had already started a petition against the new design. 3 major hospital systems had raised red flags after seeing the prototype. The patient safety team at Northeast Medical Center was considering canceling their standing order of 3,000 units. That's what Darius had seen on my screen that day he appeared in my basement doorway. That's why my phone suddenly exploded with messages after 2 weeks of silence. The first call came from legal. "Miss Abani," the clipped voice said, "we need a full accounting of which external parties you've been communicating with regarding the MetaFlow redesign." The second call came from product design. "Leora, it's Nolan from design. We're being asked to reconsider the emergency shutoff placement. Can you join a call to explain the concerns again? In detail this time?" The third call came from our biggest client, Northeast Medical. "Thank God we found you," said Dr. Kessler, their chief of nephrology. Nobody else would listen. They kept telling us the redesign was finalized. We were about to cancel our entire order and go with competitor X. By the end of the day, my voice was hoarse from explaining the same concerns over and over to people who should have listened the first time. My personal email inbox overflowed with messages from patient advocates, hospital administrators, and safety compliance officers. I sat back in my wobbly chair, staring at the water stain on the ceiling that resembled Australia. The basement was quiet again, but my mind raced. Something major was happening upstairs, something triggered by my conversations with Zoe and others. My company phone lit up with a message from Darius's executive assistant. Meeting tomorrow, 8 a.m. Boardroom. Bring all patient safety documentation. I powered down my devices, gathered my things, and walked out of the basement for what I assumed would be the last time. They were either going to fire me for unauthorized external communications or, well, I couldn't imagine an or. I'd broken protocol. I'd gone around official channels. Even though I'd done it for patient safety, corporations rarely reward such behavior. As I drove home, I wondered if I'd just sacrificed my entire career. 6 years building relationships, establishing credibility, working my way up, all potentially gone because I couldn't stay quiet about a button placement. Would it be worth it? Would they actually change the design? Or would they just eliminate the troublemaker and proceed as planned? The answers would come tomorrow. I just hoped I could sleep before facing whatever storm awaited me. I arrived at the office at 7:30 the next morning, clutching a travel mug of strong coffee. The building was eerily quiet, too early for most employees. I'd spent half the night organizing my thoughts and downloading every piece of patient feedback I'd ever collected about accessibility issues. The boardroom lights were already on when I reached the top floor. Through the glass walls, I could see Darius at the head of the table, scrolling through his tablet. 3 people in suits I didn't recognize sat to his right. Elliot sat alone on the left side, his normally perfect hair disheveled, his leg bouncing nervously under the table. No one smiled when I entered. No one even looked up except Darius. "Leora, sit." He pointed to a chair at the opposite end of the table from him. I settled in, placing my laptop and notes in front of me like armor. The 3 strangers watched me with clinical interest. "Do you know why you're here?" Darius asked. "I assume it's about my communications with patient advocacy groups." "Partly." Darius leaned forward. "Yesterday afternoon, I received a call from Alexandra Wright, the CEO of Northeast Medical. She informed me they were canceling their standing order of 3,000 Metaflow Pro units due to, and I quote, serious patient safety concerns that your company has repeatedly ignored despite warnings from your own staff." Elliot shifted uncomfortably in his seat. "She specifically mentioned you by name," Darius continued. "She said you were the only person at this company who seemed to understand the life-threatening implications of the redesign." Then, within hours, I received similar calls from 7 other major hospital systems. He slid a document across the table. "This is a list of projected losses if these orders are canceled. $97 million. Potential lawsuits that could triple that number if a patient is harmed. And incalculable damage to our reputation." My throat tightened. I didn't tell anyone to cancel orders. I just answered questions about the redesign. "We know," said one of the strangers. She had silver-streaked black hair and sharp eyes. "I'm Gwen Porter, outside counsel. We've reviewed your communications. You didn't share confidential information or disparage the company. You simply confirmed what these clients already suspected, that the redesign prioritized aesthetics over user safety." Elliot's face had turned an alarming shade of red. "She went around official channels." Official channels? Darius cut him off. "Like the design review where she raised these exact concerns and was ignored? Or perhaps you mean the proper procedure of demoting her to a basement closet when she questioned your judgment?" The room fell silent. I couldn't believe what I was hearing. Darius had never spoken to Elliot like this before. They were golf buddies, vacationed together at adjoining beach houses. "What I want to understand," Darius continued, turning back to me, "is why you didn't come directly to me with these concerns." I took a deep breath. "With all due respect, sir, I tried. I sent you 3 emails detailing my concerns after the redesign was first proposed. I requested a meeting twice. Your assistant said you were fully aligned with the new direction and didn't need additional input." Darius's expression shifted. "I never saw those emails. I can forward them to you again, with the original timestamps." The third stranger, a man with salt and pepper hair and wire-rimmed glasses, cleared his throat. That won't be necessary. We've already retrieved them from the server, along with dozens of other communications where Miss Abani raised these concerns through appropriate channels. He nodded toward me. I'm Thomas Weber, head of the board's audit committee. We've been conducting a review of internal communications related to the MetaFlow Pro redesign since yesterday afternoon. Elliot stood suddenly. This is absurd. We followed proper design protocols. We conducted user testing. Just because one employee has a personal vendetta? Sit down, Elliot, Darius said quietly. When Elliot remained standing, Darius's voice hardened. I said, sit down, now. Elliot sank back into his chair. Thomas Weber tapped his tablet, and the large screen on the wall lit up with a spreadsheet. Our review found no evidence of the extensive user testing you repeatedly referenced. There were 2 focus groups, neither of which included participants with mobility limitations or current dialysis patients. He scrolled to another document. We also found that you repeatedly filtered Ms. Abani's concerns from reports that went to upper management, labeling them as unnecessary negativity and resistance to innovation. My head spun. They had been investigating Elliot, not me. Miss Abani, Gwen Porter addressed me directly. Northeast Medical and the other hospital systems have agreed to reinstate their orders on one condition. You personally oversee a safety review of the redesign and approve any changes. Me? I stared at her. But I'm just in customer success. I don't have design authority. You do now, Darius said. Effective immediately. We're creating a new patient safety and accessibility division. You'll head it, reporting directly to me. Your first task is to fix the MetaFlow Pro redesign before we lose $97 million and our reputation. Elliot slammed his hand on the table. This is outrageous. She has no design experience, no engineering background. She has something more valuable, Thomas Weber interrupted. She has lived experience as a patient, 6 years of collecting user feedback, and the trust of our biggest clients, something you've managed to destroy in less than a year. Darius stood, signaling the meeting was ending. Elliot, stay. Everyone else, thank you. As we filed out, I heard Darius say quietly to Elliot, this isn't a conversation you want to have in front of an audience. I spent the next hour in a daze, escorted by Darius's assistant to a newly vacated office on the executive floor. My belongings from the basement were already there, looking out of place among the high-end furniture. My computer access had been expanded to include design files, testing protocols, and direct communication with the manufacturing facility. By mid-morning, I'd assembled an emergency response team, 2 engineers who had quietly supported my concerns, a usability specialist who'd been sidelined by Renata, and a project manager known for her attention to detail. We took over the largest conference room, spreading out design documents across the tables. The emergency shutoff button is the most critical issue, but not the only one, I explained, highlighting sections of the design. The control panel's new layout has buttons too close together for people with tremors or neuropathy. The reduced screen size makes critical numbers harder to read, and they've eliminated physical buttons in favor of touchscreen controls that won't work with medical gloves or for patients with circulation issues in their fingers. How did all this get approved? Asked Peyton, one of the engineers. It didn't. Not really, I said. The full designs were never properly reviewed by clinical specialists. Elliot managed to segment the approval process so no one saw the complete picture. We worked through lunch, ordering sandwiches that went half-eaten as we reimagined the device from the patient's perspective. By 3 o'clock, we had a working alternative that preserved the sleeker aesthetic while restoring critical safety features. At 4, Nolan from design knocked on the conference room door. His eyes were red-rimmed. Renata's been let go, he said without preamble. And Elliot, he's been suspended pending a full investigation. They're escorting him out now. I stood and moved to the window. 3 floors below, I could see Elliot walking to his car, a security guard following a respectful distance behind. His shoulders were slumped, nothing like the imperious figure who had banished me to the basement 2 weeks ago. They're saying you saved the company, Nolan continued, that if those orders had been canceled, we might have gone under. He hesitated. I should have backed you up in that meeting. I knew you were right. I was afraid of ending up in the basement too. I turned to face him. I understand fear, Nolan. But when someone's life might be at risk because of something we've built, we have to be brave enough to speak up. He nodded, ashamed. The design team wants to know if we can help with the revisions. We could use the support. But understand this. Safety comes first. Always. If that's a problem, speak now. It's not a problem, he said quietly. Not anymore. The next week blurred past in a frenzy of redesign work, meetings with hospital administrators, and calls with patient advocacy groups. I slept maybe 4 hours a night, fueled by adrenaline and purpose. My new team expanded to 15 people, all dedicated to making the MetaFlow Pro both beautiful and safe. On Friday afternoon, Darius called me to his office. He looked exhausted, the polished CEO veneer cracked to reveal the worried human beneath. The board met this morning, he said, gesturing for me to sit. They reviewed everything, the design process, Elliot's decision-making, the potential financial impact if we'd continued on that path. I waited, unsure where this was going. They also reviewed your history with the company, your performance reviews, client testimonials, the safety improvements you've suggested over the years. He sighed, many of which were apparently buried by middle management because they would have required expensive changes. I never knew that, I said honestly. Neither did I. He looked out his window at the city below. I built this company 20 years ago because my brother needed dialysis, and the machines available then were terrible. Somewhere along the way, I lost sight of why we exist. He turned back to me. The board has approved a complete restructuring of our product development process. Every design will now require sign-off from your division before proceeding, and they've approved a substantial budget for you to build your team. Thank you, I said, still processing the implications. Don't thank me, he replied. This should have happened years ago. He pushed a folder across his desk. There's something else. The board wants to appoint you as chief patient advocate, a new C-suite position reporting directly to me. I opened the folder to find an employment contract with a salary that made me blink twice to confirm I wasn't hallucinating. This is very generous. It's what we'd have paid the next director of product development, which was going to be Elliot's next role. Darius's mouth twisted. Consider it a reallocation of resources toward actual value. I closed the folder. Before I accept, I need to know something. Was Elliot the exception, or was he following an unspoken rule? Will I be fighting this battle with every new design? Darius didn't answer immediately, which told me everything. Let me be clear, I said, surprising myself with my boldness. I won't be a figurehead or a box to check for PR purposes. If I take this role, I need real authority to stop unsafe designs, even if they're someone's pet project, even if delays cost money, even if it means occasionally saying no to you. He studied me for a long moment. You know, when Elliot first suggested moving you to the basement, he told me you were difficult and resistant to innovation. I'm starting to understand that what he meant was, she won't compromise on patient safety. He nodded slowly. Yes, you'll have that authority, in writing, and the board will back you up. I should have felt triumph. Instead, I felt the weight of responsibility settling on my shoulders. Then I accept. That evening, as I packed up my temporary office to move to my new, permanent one over the weekend, Maya appeared in my doorway. She'd been one of the snickering group behind Elliot that day in the basement. Everyone's talking about your promotion, she said, hovering uncertainly at the threshold. I'm sure they are, I replied neutrally, continuing to pack. I just wanted to say. She stepped inside, lowering her voice. Elliot told us you were being moved because you had performance issues, that you'd been making mistakes and blaming others. We didn't know it was because you'd raised safety concerns. I set down the book I was holding, and you believed him without question. She flushed. He was the boss. Yes, he was. And bosses are never wrong, are they? I sighed. What do you want, Maya? Absolution? Friendship? What? I don't know, she admitted. Maybe just to say I'm sorry, and that I'm glad you're the one in charge now. I studied her face, looking for insincerity, but finding only genuine regret. Apology accepted. But Mia, I'm not the only one who should have spoken up. Remember that next time. She nodded and left. I finished packing in silence, thinking about power and responsibility, about speaking up and staying quiet, about how organizations become what we allow them to be. Something had shifted fundamentally in the company this week, but as I looked at the prototype of the redesigned MetaFlow Pro on my desk, now with the emergency shutoff button prominently placed where anyone could reach it, I knew the real work was just beginning. What I didn't know was that Elliot was already plotting his return, and that his version of punishment would make my basement exile look like a luxury retreat. 3 months into my new role, things were finally stabilizing. The redesigned MetaFlow Pro had gone into production with all safety features intact. Hospitals were thrilled with the improvements. Our stock price had recovered from the brief dip that followed rumors of canceled orders. I had built a team of 15 dedicated people, including several former patients who brought invaluable perspective. I should have known the calm wouldn't last. The first sign came when Tara, one of our best engineers, resigned without notice. Then Brett from sales, then Wei from quality assurance. Within 2 weeks, 7 key employees had left, all without adequate explanation. Their departure emails contained the same vague language about exciting new opportunities and career growth. Darius called me to his office after the 7th resignation. They're all going to the same place, he said without preamble. A new medical device startup called Vital Innovations. I felt a chill. Elliot? Darius nodded. He secured funding remarkably quickly. They're positioning themselves as our direct competitor, focusing on revolutionary design that doesn't compromise on functionality. His mouth twisted. Sound familiar? He's using our own language against us, I realized. The messaging I developed for the safety-improved MediFlow. Exactly. And he's telling potential investors that our recent redesign was actually his idea, but he left because you took credit. My blood boiled. That's completely backward. I know, but he's convincing. And he's hiring away our talent with promises of equity and inflated titles. I paced the office, trying to think, what do we do? For now, we focus on retention. I've approved bonuses for key team members, but there's something else. Darius slid a printout across his desk. This arrived at several hospitals yesterday. It was a slick promotional flyer for Vital Innovations' first product, a portable dialysis system called PureFlow that looked suspiciously similar to our MetaFlow Pro, but with modifications that made it appear even sleeker. He's created a knockoff, I said, studying the images, with all the same safety issues we fixed in our redesign. Worse, Darius replied. Look at the specs. I read through the technical details and felt my stomach drop. This can't possibly work as described. The filtration rate they're claiming would require either a much larger pump or cutting corners on safety features, Darius finished. Exactly. Have any hospitals placed orders? Not yet, but Northeast Medical is considering a trial. Apparently, Elliot personally visited Dr. Kessler last week. Alexandra Wright approved this? I couldn't believe the CEO who had threatened to cancel orders over safety concerns would even consider Elliot's product. No, she's on sabbatical. Kessler's running point on procurement while she's gone. I stood. I need to call him immediately. Already scheduled. Video conference in 20 minutes. Conference room B. Dr. Kessler's face filled the screen, his expression guarded. Leora, this is a surprise. Is it? I would have thought you'd call me before considering Vital Innovations' product. He shifted uncomfortably. We're simply exploring options. Elliot presented some compelling innovations. Elliot was suspended from our company for ignoring patient safety concerns. The same concerns you raised about the MetaFlow redesign. He explained that situation, said you misrepresented his design to advance your career, that the safety issues were greatly exaggerated. My mouth went dry. And you believed him? After everything? Dr. Kessler hesitated. He brought very convincing documentation. And frankly, his price point is significantly better than yours. Because he's cutting corners on safety components, I insisted. The filtration rate he's promising is impossible with the power supply he's using unless he's eliminated critical backup systems. He assured me all safety protocols exceed industry standards. Can I see the documentation he provided? Dr. Kessler hesitated. I'm not sure that would be appropriate, given your competing interests. Our competing interest is patient safety, I said firmly. Nothing more, nothing less. If his design is truly safe and innovative, I'll be the first to congratulate him. But given his history, I have serious concerns. Something in my voice must have reached him, because after a long pause, he nodded. I'll send over his presentation. But, Leora, we need to make a decision by next Friday. Alexandra returns Monday, and she'll want my recommendation immediately. After the call ended, I sat motionless, trying to process Elliot's audacity. He wasn't just competing with us. He was actively rewriting history, painting himself as the safety advocate and me as the villain. Dr. Kessler's email arrived an hour later with Elliot's complete presentation attached. I printed it out and spread the pages across my desk, examining each claim, each specification. each glossy image of the PureFlow device. The similarities to our original designs were striking. Elliot had clearly taken our work and modified it just enough to avoid outright plagiarism. But the differences were what concerned me most. The emergency shutoff was once again placed on the back panel. The interface was entirely touchscreen. The backup power system had been reduced to a bare minimum, and scattered throughout were subtle digs at our company, implications that we had over-engineered safety features at the expense of user experience, that our recent redesign had been reactionary rather than innovative. The last slide made my blood run cold, a timeline showing Elliot proposing safety improvements that were ignored by management until he left to start his own company. My name appeared as the person who had resisted changes and later claimed credit for his work. It was a masterful revision of reality, one that painted him as the heroic whistleblower forced to leave in order to truly protect patients. I forwarded the presentation to Darius with a single line: "We have a bigger problem than I thought." The next morning, I received a text from Zoe, the patient advocacy leader. "Elliot from Vital Innovations reached out, wants me to publicly endorse PureFlow, says you've been exaggerating safety concerns." What's happening? My hands shook as I called her. "Don't endorse anything until you see the actual device." "He's lying, Zoe, about everything." "I figured as much," she said. "But he's contacting everyone in the patient community, offering free trials, speaking fees, advisory board positions. People are listening." For the next week, I barely slept. During the day, I met with hospital administrators, showing them detailed analyses of the safety flaws in Elliot's design. At night, I joined patient group calls, answering questions and countering misinformation. Elliot's smear campaign was gaining traction. Investors were growing nervous. 3 more employees left for Vital Innovations. Northeast Medical still hadn't made their decision, but rumors suggested they were leaning toward Elliot's product. Thursday night, the day before Dr. Kessler's deadline, my phone rang at 1:01 p.m., an unfamiliar number. "Is this Leora Abani?" a woman's voice asked when I answered. "Yes, who's this?" "My name is Tanya Reed. I'm Elliot's executive assistant at Vital Innovations." She spoke quickly, her voice low. "I don't have much time. He doesn't know I'm calling you." I sat up straight. "What's this about?" "The PureFlow device. It failed safety testing yesterday, catastrophically. The emergency protocols didn't engage when the main system failed. If it had been connected to an actual patient." She didn't finish the sentence. "Are they delaying production?" I asked. "No, that's why I'm calling. He ordered the test results buried. They're proceeding with manufacturing. With minor modifications he claims will fix the issue. But the engineers say the fundamental design is flawed." My mind raced. "Do you have documentation of this?" "I think," a pause. "Yes, but if he finds out I shared it." "I understand. Why are you doing this, Tanya?" Her voice cracked slightly. "My mother is on dialysis. I took this job because I believed we were creating something that would help people like her, not endanger them. I'll protect your identity," I promised. "But I need those test results. Check your email in 5 minutes. I've created an anonymous account." She hung up. The documents arrived exactly 5 minutes later. Internal test reports, engineering assessments, and most damning of all, Elliot's emails ordering the team to adjust the test parameters and focus on the positive outcomes while ignoring the critical failures. I forwarded everything to Darius and our legal team, then called Alexandra Wright directly, despite the late hour. "Alexandra, it's Leora Abani. I apologize for calling so late, but this is about patient safety. I just returned from sabbatical today," she said, sounding tired. "Dr. Kessler briefed me on the Vital Innovations proposal. Have you made a decision? We're meeting tomorrow morning. Elliot is presenting at 9. I need to show you something first. It's urgent." She hesitated. "Can it wait until business hours? If you're considering purchasing devices that could endanger patients, then no, it can't wait." There was a long pause. "I'll meet you at Northeast Medical at 7 a.m. My office." I arrived at 6:45, armed with a comprehensive presentation and all of Tanya's documents. Alexandra was already there, looking refreshed despite the early hour. "This better be important," she said as I set up my laptop. "It's about lives," I replied simply, and began. For the next hour, I walked her through everything: the failed safety tests, Elliot's orders to cover them up, the fundamental design flaws that made the PureFlow dangerous despite its appealing aesthetics. I showed her side-by-side comparisons with our redesigned MetaFlow Pro, highlighting the crucial safety differences. When I finished, she sat in silence for several minutes. "You understand what you're alleging," she finally said, "that a medical device manufacturer is knowingly planning to sell dangerous equipment." "Yes, and I have the documentation to prove it." She nodded once, decisively. "I need to make some calls. Wait here." At 8:55, Alexandra led me to their largest conference room. Through the glass walls, I could see Elliot already inside, arranging promotional materials on the table. He froze when he spotted me. Alexandra opened the door. "Elliot, I believe you know Leora Abani." His smile was strained. "Of course, though I'm surprised to see her at a private meeting about our products." "This meeting has been expanded," Alexandra replied coolly. "Please, continue with your presentation." For the next 40 minutes, I watched Elliot deliver his pitch flawlessly. He was charismatic, confident, making grand promises about the PureFlow's performance and safety features. He deftly incorporated the minor modifications Tanya had mentioned, presenting them as innovative improvements rather than emergency fixes. Not once did he acknowledge my presence or the tension that filled the room. When he finished, Alexandra simply said, "Thank you, Elliot. That was very thorough." She looked at me. "Leora, would you like to respond?" I stood and connected my laptop to the projector. "Before I begin, I want to clarify something. This isn't about competition between companies. It's about patient safety." I displayed the first slide, the internal test results showing the PureFlow's catastrophic failure. "These are your own company's safety test results from 2 days ago," I said directly to Elliot. "Tests that you ordered hidden." The color drained from his face. "Where did you get those?" "Those are proprietary. From someone at your company who was concerned about patient safety." I cut him off. "Someone who wasn't willing to risk lives for profit." I continued through the presentation methodically, showing his emails, the engineering reports, the hasty modifications that engineers had deemed insufficient. With each slide, Elliot grew more agitated. "This is corporate espionage," he finally sputtered. "She's trying to sabotage us because we're a threat to her company's market dominance." "Is any of this information incorrect?" Alexandra asked him directly. "It's taken out of context," he managed. "Early testing always reveals issues that need to be addressed." "And were these issues addressed adequately?" she pressed. "Of course," he insisted. "The modified design is completely safe." I displayed the final slide, an email from Elliot to his engineering team, dated yesterday. "We don't have time for another full round of testing. Make the minimum changes necessary to get approval. We can address any lingering issues in version 2.0. The room fell silent. Alexandra turned to Elliot. "I think we've seen enough. Northeast Medical will not be pursuing a relationship with Vital Innovations. Additionally, I'll be sharing these concerns with our colleagues at other hospital systems and with the regulatory authorities." Elliot stood abruptly. "This is a setup. She fabricated these documents. You can't possibly—" "Elliot," I interrupted quietly. "Every document I've shown today has been authenticated by 3 independent sources, including your own engineering team, members of which, I should add, have already contacted the FDA with their concerns." His face contorted. "You've been planning this from the start, haven't you? Ever since the basement. This is your revenge." I met his gaze steadily. "No, Elliot, this isn't revenge. This is accountability. Something you tried to avoid by silencing me, by twisting the truth, by putting your ego above patient safety. You'll regret this," he hissed, gathering his materials. "Both of you." After he stormed out, Alexandra turned to me. "I owe you an apology. We should have been more skeptical of his claims given his history." "You didn't know the whole story," I acknowledged. "Few people did." "Well, they will now." She picked up her phone. "I need to alert our colleagues at other hospitals immediately, and I believe you have calls to make as well." Vital Innovations collapsed within 3 weeks. Their investors pulled out after learning about the safety cover-up. The FDA launched an investigation. Elliot's borrowed credibility evaporated as the truth emerged. 6 months later, I stood on a stage at the annual Medical Device Safety Conference, accepting an award for our patient-centered redesign process. As I looked out at the audience of healthcare professionals, engineers, and patient advocates, I spotted a familiar face in the back row. Tanya Reed gave me a small nod. She'd found a new position at a reputable company after Vital Innovations imploded. Her mother was doing well on our redesigned MetaFlow Pro. The lesson I hope we all take from this experience, I concluded in my speech, is that patient safety isn't a marketing slogan or a box to check. It's the fundamental purpose of our work. And sometimes, speaking up about safety concerns isn't just the right thing to do. It's the only thing to do, no matter the personal cost. The applause was thunderous, but it wasn't what moved me. It was the knowledge that somewhere, patients were using devices that wouldn't fail them in a crisis, that the emergency shutoff button was exactly where they could reach it when needed. Sometimes, the greatest revenge isn't bringing someone down, it's rising to exactly where you were meant to be all along. If this story resonated with you, hit that like button and subscribe for more real stories about standing up for what's right, even when it costs you. Have you ever had to speak up when everyone else stayed silent? Share your experience in the comments. I read every single one, and your story might help someone else find their voice when it matters most.